Welcome everyone. We thought we would do a couple of these sessions. We've just done a session actually for people who've already signed up for this year to tell them what they're letting themselves in for, but we've had a lot of interest, and we thought we'd run a session so people would could ask any questions they wanted to ask about the course, and we could give you a bit of a flavour of it. So I'll introduce you to who's online, the panelists, in a second. In the chat box, feel free to ask any question that you want to about the masters, and we'll either pick it up by voice or we will answer it in the chat or somehow get an answer to you. We are recording this just because some people won't have been able to attend, and so we'll be making it available. So if you're, well, we have to record it, so if you're not okay with us recording it, you'll have to step out, I'm afraid. But otherwise, just to let you know, we are recording it. So I'm going to introduce people on the call. So I'm Karen Burgee, I'm Professor of Trauma Sciences at Barts in the London School of Medicine, which is part of Queen Mary University of London. I'm a trauma surgeon at the Royal London Hospital, and I am co-directing next year with my colleague Professor Susan Brundage, who is here, who's now based at Shock Trauma in Baltimore, having led the masters here for some years. We have Chris Gunton, who's our course administrator extraordinaire and the font of all knowledge about basically everything. Ross Davenport, who's also a trauma surgeon here at the Royal London, as senior lecturer in the Centre for Trauma Sciences, who's a module lead for shock and hemorrhage module. And Obi Najuba, who was a past MSc student, I think he was year one actually, student, who's also just completed a PhD with us and has now gone back into surgical training. So he can give you some idea of what it was like and things, although the course is a bit different now from when he did it. Fine, so what I'm going to do is just run through the course structure so everyone understands the course, but also give you an idea of kind of the ethos of the course and why we set it up in the first place. Tell you what you'd expect if you were to come and join the course, and then but it's probably only for about 15 minutes or so, 10-15 minutes, and then we'll throw it open to questions or comments about anything that you might want to discuss. Like I said, any questions that spring to mind, anything you want to ask, just pop it in the chat and we will deal with it as it comes up. So let me share my screen. So this is the 10th year actually of the MSc programs in trauma sciences. We started in 2011 and the course has evolved somewhat since then, but we've graduated somewhere in the region of 250, 300 students now, from all over the world, all seniorities, multi-specialty, multi-professional, paramedics, nurses, some clinical managers, some people who are just interested in the subject. And really our goals for setting it up were born of a desire to move away from the way that trauma was normally taught, which was, you know, A, B, C, D, E, you do things in rote order, you do things the same every time, and there is one way of doing things and you don't really understand why you were doing those things, to something that really allows you to have a much deeper understanding of the biology of injury and what happens to the body when it's been injured, what happens to the person when they've been injured, and also how they then get rebuilt and reconstructed and how they recover or not. from injury, but something that therefore gives you a full understanding of the complexity of what it's like to be injured, but also then the complexity and how all the different components of care take shape around that person and should be geared towards that very patient-focused care. So from whether you're in pre-hospital care, whether you're emergency medicine, anesthesia, surgery, rehabilitation, physiotherapy, everybody has a part to play in it, but really the more you can have much more input and much more effect if you understand what has come before and what will go after, and more importantly, why you are doing things. And in understanding why, you can then understand what you should be doing and how you can best deliver that. So we felt that there was a need to offer education that had some depth to it, and then also education that fit where the disease was the most prevalent. And of course, it's a global disease that has global reach. And so we needed to make it as global as possible. And so it's been distance learning from the start, essentially. A lot of universities are trying to pivot to distance learning now, which is basically record the same old talks that they gave in person. But we have learned a lot about how to deliver effective distance learning over the past 10 years, and it's not the same, but it's really been vital for us to be able to teach people over a distance, because it's meant that we could offer the same level of teaching and interaction to people who are around the corner from the Royal London Hospital as we could to people in Southeast Asia, in China, in Africa, in North America. And also that they bring their own experience and input into that then, so that actually what we're doing is learning from each other about the condition. And so many of our experience is very much focused on our own personal experience of one hospital or one small region, and so therefore we naturally think there is one way of doing things. Whereas actually there are many ways of achieving the same goal, and many of the things that we have to do every day are tailored to the environment that we find ourselves in, the expertise that is around us, what interventions we have available to us. And that's even more stark when you are in a lower middle income country, when you are trying to offer humanitarian trauma care, when you're in a military field, when you're in the middle of a disaster or a mass casualty situation. And so hopefully what we try and do is build this framework within which you can deliver injury care, no matter what your specialty, no matter what your background, because you have the understanding of what it takes to help somebody survive and recover and after injury, contextualized for where you are and where you want to go in your future career. And the other thing that's important to us, and was important to the course from the beginning, is that this is very much adult learning. It's not medical student learning or school learning where we shove lots of information at you. This is about adults learning in the era of the internet, where you can look up anything on Wikipedia or anything. So this is not about shoving lots of information down your throat. This is about teaching you about the experience of learning, finding equipment, finding knowledge, learning from each other, sharing learning, and actually developing your knowledge as you go. So actually every year has been different, not just because the content gets updated, but also because the participants are different and they get different things out of it and put different things into it. And so the faculty learn as much as well, because of all the experience that we are exposed to from the people. So the course is based here. This is the Blizzard Institute, which is part of Queen Mary. This is where the Centre for Trauma Sciences, and this is in Whitechapel in East London. This is where Chris sits when we're not in the middle of a pandemic, and where my Ross and my office is. And if you come to summer school on the course, this is where be based for summer school. And right next door on campus is the Royal London Hospital, which is the big blue building in the back, or the new Royal London Hospital, which is the big blue building in the background, which is one of the busiest major trauma centres in Europe. And so there's a very close interplay between the university and the hospital, and it's very much a clinical academic course and not a pure university course or a pure hospital-based course. And there's a lot of experience, and there's a wealth of knowledge from the clinicians in the hospital that's also brought to bear on the course. But we're not limited to faculty from the hospital being distance learning, and so actually your faculty is global, and we've chosen the best faculty for the best experience in terms of the different lectures and the different topic areas and the different knowledge, and that is a true advantage of the distance learning program. It's just another view of the Blizzard. I have no idea why I put another picture of the Blizzard in, apart from it's a nice building. These are the labs underground where our wet lab research is done. So our trauma sciences programs, we offer 3 programs. You may know this already. We started with trauma sciences and trauma sciences military and humanitarian, which are only slightly different from each other, and I'll explain that difference. And then we've more recently, but I think now in its 5th or 6th year, run the orthopedic trauma sciences course, which has a more orthopedic focus, reconstructive focus to it. In the university, these come as part of a suite of acute care courses now, which includes a critical care MSc and a emergency medicine MSc. But this one, ours are purely focused on trauma, but the breadth of trauma from pre-hospital care all the way through to rehabilitation and recovery, although focusing more on the front end most part. And it's 2 years part-time effectively, so most people are holding down busy clinical jobs or other jobs at the same time. And so year 1, there are some core modules, 6 core modules in year 1, and then a 7th elective module, which is either burns and wound healing or military and humanitarian. You can do, if you're on the trauma sciences MSc, you can do either elective. If you're on the military and humanitarian MSc, you have to do the military elective. But you see all the content from the course, so all the course content is available to you. Then we have a summer school where participants come to East London for 2 weeks during the summer. And we have a very immersive program of experiential trauma, I would say is probably the best way of describing it. It's not, we don't teach you really any didactic stuff then. It's all about different, trying to integrate everything that you've learned. It's an optional summer school because we recognize that some people can't get away from where they are for 2 weeks or can't afford to or something, but it's a part of the course that really brings it together. And then year 2, there's a research methods module, and that leads into your dissertation. And the dissertation is essentially something that's potentially publishable. We have had a number of people publish their dissertations, but it's a research-based dissertation, which you're expected to complete by the end of the year, and I'll talk more about that. In terms of the modules that you'll cover, so these are the 7 modules, or 6 and 2 elective modules. So each module is 4 weeks, and so you've got trauma, the disease, which covers epidemiology and some principles, if you like, principles of pre-hospital care, principles of mass casualty care, principles of trauma scoring, and also about systems of trauma care and different trauma systems around the world and how they organize themselves or not. Then module 2 is hemorrhage and the response to injury, which is the one that Ross leads on, and we talk about the body's response to being injured, and leads into the majority of the module, which is on shock management, bleeding, coagulation, etc. Module 3 is brain and spinal cord injury with a strong focus on brain injury as disability and obviously injury. Then the following semester, in the start of the year, rolls on to torso trauma, which is more clinical, about the management of different aspects of torso trauma. Then into extremity and vascular trauma, and then a module on the critical care aspects of trauma. And then into the 7th module, which, as I said, is either burns and wound healing or military and humanitarian. Each module has its own module director who runs the course for that 4 weeks, and who you'd have direct contact with over that time. And in general, the modules are structured as the first week as principles, which may be biology, systems principles, things that are basic to the understanding. 2 weeks that roll into more clinical matters, and then moving towards what's coming in the future, things that are coming down the line, new innovations in the 4th week. It's flexible, of course, but that's the generic structure of the modules. And it's all run through a QM Plus system, so which is an educational online system which has a number of components, and essentially each week's content is released at a time, so you don't get overwhelmed by having everything all at one go. And there's an assignment associated with each section of it, which is usually a small quiz. But 3 of the modules have 3 essays associated with them that you have to complete and are marked by the faculty tutors. And then within each week, what will happen is you'll get a number of lectures opened up, and these are very high quality now, lectures delivered by experts in the field. This is John Holcomb from now Alabama University, who talks about damage control resuscitation. So you have these lectures where you can see the lecturer and the content. And there's usually between about 5 and 8 of those per week. And there's some associated reading materials, and then the assessment at the end of the week, and then the week starts again with a whole new bunch. So it is quite a lot of material. The material's available to you the whole time, but it is a reasonable amount of work, and so you have to be quite organized to keep up with it all while you're also trying to do a job. And something, but it's definitely doable. It becomes your free time and your Netflix, basically, Netflix substitute, basically. So I see we've got a couple of questions. Let me just quickly pick up. Okay, we can pick those up at the end. So click that button. And then once or twice a week, we hold online sessions where essentially you dial in with the module organizer or course director, and you talk through whatever you want to talk through, basically. Usually it'll start with a case or something that people want expanding on from the lecture materials, something to clear up anything that you don't understand. Use some real cases to illustrate some of the principles, anything really, but again, very much learning from each other. And not everybody can make every online session, and that's completely fine. They are recorded, but it's a way of getting a much closer relationship, both with your tutor, with the module director, to actually engage in direct discussion, but also to start hearing other people's point of view and thoughts, and meet each other that way. And then it's summer school, which, as I said, is not didactic. We run a number of programs to kind of bring everything together in different ways. This is a session that's run at the Simulation Centre in the Educational Academy at Barts. We have sessions on with London's Air Ambulance on the helipad, talking about managing these situations, difficult situations, team management, that sort of thing, and buckets of water being chucked over you for no apparent reason. Ross runs a difficult decision day. We run a wet lab on how to do a resuscitative thoracotomy and why you should do a resuscitative thoracotomy at veterinary college. And the whole thing is also brought together by a group project, where essentially the whole group is tasked with coming up with a solution to a problem. And that's something that runs throughout the whole 2 weeks. And there's some strange shenanigans that happen in summer school that I'm never party to, and I have no idea what's going on. But a good time is had by all, as well as quite a lot of intense thinking and learning about yourself. And the other thing that we're trying to do really is create leaders for the next generation of trauma care. And although these people don't look like leaders, they've managed to bond together in a very short period of time over some very hard work, actually. And there's definitely a friends for life type thing, but also knowledge for life, context for life. And a lot of people have gone on to do good things after. So summer school is a big part of the course, although it's not the be all and end all, absolutely. And some people. The other thing that summer school does is introduce you to starting to think about your dissertation year. And dissertations are very varied, depending on what people are interested in, what resource they have available to them, how much time they think they're going to be able to devote to the project. We have had a number of them published over the years. I think probably close to 20 now, but it's by no means a requisite. It's a little bit over the word count of a normal publication, so it's easily cut down to a publication. Some are very research-based. The majority are probably systematic reviews that are easy to conduct in time. Some of them are qualitative studies or surveys. And what we try and do is pair you up with a faculty member or find somebody who can work with you on your dissertation. That might be somebody who works in the same field as you, be it in a different region. It might be somebody who is in your local hospital or a hospital close to you. It might be somebody who's got specific expertise in the thing that you want to work in. We try and work things out so that you are able to get the support that you need to progress your dissertation. Year 2 is very much less structured than year 1. So you've got a lot more time on your hands in year 2. But it also means that you have to be a lot more self-directed in year 2 in terms of actually getting the dissertation done. But we do try and keep you on track with regular contact. And Elaine Cole, who couldn't be on the call today, she's the year 2 leader who take you through those things. So I think that's all I wanted to say in terms of overview. I think some of you will have known that already from what you've read about the course before, but we're all here to take questions and deal with anything that you want to ask. I think we had a few on the Q&A. I'll take a couple of questions and I might ask the faculty to give their own opinions or additional thoughts in session. Actually, first question is to Obi. As a general surgical trainee, how did this course impact your practice? Obi, maybe what you could do is just say a little bit about your experience of the course in general, and then answer the question about how it's helped you or not.
Right. Good evening, everyone. So I was in the first year of the MSc course, and I joined fresh out of medical school, so first year junior doctor. And I mean, for me, it was great because I'd always been interested in trauma, and that thirst for knowledge was never quite satisfied in med school. So here I had the opportunity to go into something quite in depth. And at the time I did it, 2011, a lot of the things, we were learning were at that time, outside of major trauma centers, quite, cutting edge. Not a lot of people knew about damage control, resuscitation, and so on. So I actually found that I was picking up things that I was taking to my place of work, at the time, and actually, teaching people. In fact, I did set up I did a lecture on one day for all of the other junior doctors, essentially relaying information that I got from the course, and teaching them about damage control principles. So, that kind of stuck with me, and, continued to fuel my interest, and it's kind of led as it's been a gateway to the further work that I've done with my PhD, working in the same department. In terms of how it's influenced my work, well, I think it's difficult because I work at the Royal London Hospital, and in a place like this, everyone really buys into the principles. It's being led by the people that work at this hospital, and it's probably the same for most of the other trauma centres in the country. So it would be useful, if you're someone who's working in another part of the world where knowledge of this stuff is not as widespread as it is here. That's probably where you'll find it quite good. The summer school was great. Met a lot of people, people that are still very close friends now, and been to my wedding, and I go and stay with them overseas. It's an opportunity to meet a lot of faculty that you hear about them, you've read their papers, and now you get an opportunity to engage with them more closely. So it is it does open a lot of doors if you're interested in a career in trauma, in pre-hospital care, and emergency care. So yeah, I mean, as I said, it's for me as a junior doctor, it was very useful, and it's kind of guided me along the way and opened a lot of doors for me.
Thanks, Obi. I'm going to take the questions out of order, actually, and I might bring Susan in for this one. Susan, so Susan has been the course director for the past 5 years, 7 years, and is still very much engaged with the course despite having moved back to the States. But Susan also has a very global interest in trauma care. So Susan, I'll ask just for you to give your general impression about the course now and anything you wanted to add. But there's a question here as well, Susan, about I'm in Chad, Central Africa. This from Yusuf. Do you want to just talk about how we tailor it to wherever they are?
Yeah, that question's a perfect segue into just a couple things. Krim did a beautiful overview of the course itself. What I'd like to do is just spend a minute or two doing a brief overview of the student cohort, and then specifically ask the question about from Chad. One of the real beauties of this course is that the faculty and the students are international. And one of the questions we saw already today is, do you have to live in the UK? You can live anywhere in the world. Historically, we've been about 50-50, about 50 UK based and 50 around the world. The students take it for various reasons and our various levels. The age range has been from 26 years old to 65 years old. And you'll see there are prerequisites listed in the application and on the website. But one of the basic prerequisites is you have to have a passion and interest and some sort of clinical exposure or experience in trauma. So, and also the type of people that enroll on the course are very multidisciplinary. I think that is going to address a couple of the questions out there. Anesthesia has a very strong presence in the course, both faculty and student-wise. Of course, surgeons do, and that is not just general surgeons, it is neurosurgeons and OMFS and orthopedic surgeons, of a fair number of emergency medicine. Both trainees and consultants do take the course, and a very strong paramedic and nursing cohort. Some of our best students have been nurses. Elaine Cole is a nurse. So a beauty of the course is we can take the patient basically from roadside to rehab during the interactive sessions that we have. I think that brings a lot to the program itself. As far as CHAD specifically, absolutely. We have a strong network of both students and alumni from sub-Saharan Africa. We have people that have worked more in education as well as clinically in austere environments. We have the Commonwealth Scholarship, which Chris can give you more information about that will help with funding. So I think we really make an effort, as Karim said, a big goal of this is you can be at the Royal London or you can be at Shock Trauma and you're an amazing system, but if you're in Chad or you're in Perth, Australia, or you're in Thailand or Sweden, what we try and do is help you bring you the foundation and knowledge and the leadership skills to recreate the idea of a trauma center in your country, in your community. So I hope that answers your question regarding the CHAD part. I would specifically say that anybody from sub-Saharan Africa should definitely take the military and humanitarian module but the Burns is open to them too. Krim, is that helpful?
Yeah,
helpful student-wise?
We've had a couple of questions about like, will you be able to fit it in within the hours that you work? The short answer is yes, because everybody else manages it on the program and everyone is doing similar sort of shifts and jobs. The sort of slightly less short answer is that it's not straightforward to do that. I mean, it's not year one is especially is not a lightweight year one. There is a lot of information coming at you, and you do have to organize yourself around that. So it's certainly possible because that's how the course is designed and delivered. But it does mean essentially that, you know, instead of watching TV when you get home, you're watching a course lecture or something, and there's a fair amount then that you would be doing at the weekend. Obi, do you want to talk about anything about workload or how you found it? It was a bit hard. Obi had a lot more to do when he was doing it than there is now, because we had an essay every module, or every 2 weeks we had an essay then, so it's gone a bit easy.
I mean, I invested in a little tablet so that I could, you know, listen to bits of lectures and take part in the weekly webinars that we did as well. And I'd often sit in the canteen at work or find somewhere quiet and go over stuff when there wasn't much going on. As Prof said, weekends and evenings were essentially taken up by the modules. The second year, I think was tougher in the sense that, you know, you didn't have all of the didactic learning. It was a dissertation year. You're, you know, left to, it was much more self-directed. And you had a deadline. But I think in my case, I was doing a busy A&E job at the time, and I had all sorts of other things going on as well, and I found that quite tough. And, you know, as Prof says, it is a learning process. You learn a lot about yourself. You know, you learn to, I think it, you know, develops your resilience, your kind of organizational skills, time management, that sort of thing. But yeah, it's doable. But obviously, it involves, you know, a bit of sacrifice from time to time.
Thanks, Obi. And Caitlin, you said coming from nursing in a trauma centre, how much will be specifically applicable to my role? Well, we would hope that most of it is, because it would hopefully give you that deeper understanding about what is going on and allow you to input more and even take leadership positions. I think if you wanted to know more about that, we would be able to put you in touch with a couple of the trauma nurses who've taken the course recently. And I think the same answer for Ellen in terms of AHPs. I don't know what your background is, Ellen, you may have written it, but we've certainly had physiotherapists and occupational therapists on the course before. It is, I would say, probably, you know, there is more focus on the front end of trauma care, but I think it does allow the AHPs to understand more what has happened to their patients before they get to them. And so it gives you that contextualization. Okay, how are we doing with questions? Ross, have you seen anything that you want to?
Yeah, there's a question from Jake, which I can touch on. I'll do that after I just give my sort of thoughts on why I think the course, you know, I think we've learned a lot over the last, you know, 7 years or more in how people want to learn, what works for people, and how bringing people from different disciplines can work and actually, you know, improves the learning experience for everybody. And it is very much a process of learning. When you start in year one, you may be quite daunted by even just critiquing a paper. And how are you going to get to, you know, the end of year two when you actually got to write your own paper? And so each of the modules is not only giving you the knowledge around trauma care and, you know, the wider aspects of trauma care, but also building very slowly your understanding of how research and clinical research works and how to critique, you know, the evidence that's out there, so that you come away with a very complete understanding of not only the knowledge, but how you build your own knowledge. And, you know, we've had a number of people that have done the course. Obi is one of them, who've actually then come back and done a PhD with us. So the level of knowledge, you know, is accessible for everybody, and you can take it, you know, to a very, very high level, you know, to a higher degree. So in answer to Jake's question directly, there will be, you know, the introductory lectures will be some duplication between what you learn as part of FEM and your, you know, emergency medicine or surgical exams that you're doing. But this course will take it very much, you know, up to a higher level. And you have the opportunity, as Obi said, to engage with, you know, international leaders in all aspects of trauma care. So, you know, there really is no limit to how far you want to take your understanding of a particular field if you're interested in one thing.
Thanks, Ross. There's a couple of questions about specialty and grade. So I think, as Susan said and others, we essentially take all grades and levels of seniority, providing that you think that you're capable of coping with the information and the delivery of the course. What that usually means is that we'll take from F2 or postgraduate year 2, the international equivalent, and upwards. We have taken F1s before, so first year interns, but you know, becoming a new doctor and dealing with everything that you have to learn as a new doctor and doing a master's is quite a tall order. So you know, you have to be fairly confident in your ability to deliver that. But the course is lots of PGY2, F2, F3 doctors have taken the course, just have lots of, as have lots of consultants, and they've managed. And in terms of specialty, it is not geared to any specialty in particular. The people who are on the course come from all different parts of medicine: anesthesia, emergency medicine, critical care, surgery, and obviously paramedics, nurses from different doctrines. So it's very agnostic to specialty. You can't though be a medical student because you can't be enrolled on 2 degree courses at the same time. So you can't be a medical student and do the course. If you've completed your finals. That's true, Chris, isn't it? In terms of the dissertation, you very much choose your dissertation or your dissertation topic area. Your faculty, tutor, and or your dissertation support person will help you in terms of saying, that's really not doable within a year, or yes, you should do that, but maybe you should structure it like this, or maybe if you want to look at that area, maybe you should do a systematic review or rather than a survey or something like that. So they'll help you frame the dissertation and the research questions or the methods that you might use. But the dissertation that you choose is very much up to you. If you choose to publish it subsequently, then more likely than not, the person people who've helped you do it will help you to support you through to getting it in shape for a publication. And no, there's no stipulation that you have to publish it in any journal. I would say though that the primary reason for doing the dissertation is to do the dissertation and to do the masters, not to have the publication. So they're kind of separate things. Doing a good dissertation and getting it published, they might overlap, but they're two slightly different things. And there's quite a short amount of time for you to actually do the research to lead to a dissertation. So that you can't do a randomized control trial, for example, in 6 months, essentially. Okay, and then I think the last that's open is, after successfully completing this course, would we be able to manage most of the trauma cases that we find ourselves in front of in the ED and pre-hospital? So this isn't a course that teaches you how to intubate patients or how to put in a trauma line or how to do a laparotomy and things. So no, you wouldn't be able to manage everything by yourself and do everything. But what you would be able to do is understand what's going on. You would understand your place within the team and what was going on around you. You'd understand the skill set that you have and when to apply it. And you would understand perhaps what skills you needed to develop. And you'd probably have a much better understanding of the resuscitation practice and the future outcomes of the patient than the team leader who was running the trauma team. So it won't teach you how to do the practical skills per se, but it will teach you the whys and the what, and things that will leave you in a much deeper understanding of the protocol-driven care response to trauma care. And yes, you can leave after 1 year and get a PG dip if you must. Can you return to do the dissertation at a later date? I don't know, Chris, you can interrupt for a certain amount of time, but not forever. Ross, do you want to take think about, is there a place for trauma science students to assist with research?
So, I mean, the short answer to that is yes. We're very open for people to come and to do projects and work with us. The longer answer though is certainly during year 1 you're going to be very busy in gaining your knowledge and getting all of the modules completed and some of the assessments. So if you are wanting to do a research project as for your dissertation, then using some of the resources we have and the data that we have, that's entirely possible. And we'll be open to helping you design and do that type of work.
Okay, there's some things in the chat as well, sorry. can I get a discount? No, I'm afraid, is the short answer, unless you can score some funding from somewhere else, but no, not really. We just don't have the capabilities or things like that. We do offer one Centre for Trauma Sciences scholarship on the course, which you can apply for. It's a competitive scholarship that's 50% of the fees. That's about the only thing outside of some of the alternate funding streams like the Commonwealth Scholarship that we. So support for the dissertation, I think we've covered. Elmenstein, Susan, do you want to pick up that? Susan knows that one very.
Yeah, I was just reading that lovely. It's a very thoughtful message, and I'm not quite the way through it. But I think what I would say that we could take this conversation offline, because I think, I know Elmine extremely well and collaborate with her. So we can definitely make something big of what you're considering here. So just an enthusiastic yes, and let's take that offline together. And I'll put in my email.
Okay, any last questions?
There's a couple more questions, Karim, in the.
Oh, sorry. Does it cover pharmacology? In what sense? I mean, yes, and as pertains to trauma, yes. I mean, it can cover whatever you want it to cover. If you think there's something missing, these are the sort of things that you can pick up in the online sessions. We don't have in-depth pharmacology. And are the dissertation topics usually systematic reviews? A lot of people do systematic reviews because it's achievable within the time frame of the masters, but it's certainly not limited to systematic reviews. We've had geospatial analysis of trauma systems, we've had cohort studies done, we've had surveys and Delphi studies done. It's open to multiple different options. The main thing is that it has to be achievable within the time frame that you've got to get written up and submitted. Okay, fine. So I think we're coming up to an hour anyway. Thank you for your interest in the course. Thank you for coming online and asking questions. We are very happy to answer any additional questions that you might have if you just email through the website, through traumamasters@qmul.ac.uk. That would get directed to Chris, and then we can pick it up from there. Hopefully we will see you, or some of you, on the course. In terms of when you have to make a decision by for this year, it's the end of August. 31st of August is the cut-off date. Typical cohort size, do you mean the number of people we have on the course? We normally have around 40 to 50 people on trauma sciences courses. Good. Okay, so thanks very much, everyone. Thank you to the faculty for joining the panel this evening. I hope we've answered your questions. I hope we've given you a flavour of the course and tantalised you with what might be to come. And yeah, we hope you'll join us this year or 1 year in the future. So thanks very much all. Bye-bye.